In this video, we'll talk about multiple sclerosis or MS. Sclerosis means scar. So multiple sclerosis means scar over different location of the central nervous system. The lesions are present in the brain and in the spinal cord. Multiple sclerosis is kind of like a progressive demyelination. So in this case, the white matter of the brain and spinal cords gets seriously affected. And this progression of this disease is really slow and often takes decades. And the demyelination is triggered by immunological reactions. There are autoreactive cells which can actually affect these myelin sheath of the neurons, which work like an insulator. The structures that are usually involved in multiple sclerosis are actually the components of CNS. Generally, the optic and the oculomotor nerves are actually affected. Also, the spinal nerve tract is affected. But this disorder does not affect the peripheral nervous system. That's the most important part. So there are several symptoms which includes vision problems, which can be understood because optic nerve tract is affected. Lesions can develop there. Numbness and tingling, walking difficulty, dizziness, weakness, fatigue, cognitive dysfunction, all of these symptoms are associated with multiple sclerosis. Now let's talk about the key symptoms. This involves dysarthria, which means difficulty or unclear speech, because the scars can also occur in the brainstem, and brainstem is crucial for speech and communication. That's why there could be speech related problems. Another symptom could be nystagmus, that means involuntary and rapid eye movement, and the optic nerve tract and oculomotor nerve tract is damaged in case of multiple sclerosis. Probably this leads to this kind of situation. This can lead to blurred vision, double vision, or even other visual difficulties. Lastly, there could be intention tremors. That means there could be like tremors developing due to lesions in the motor pathways. All these three major symptoms are collectively known as the Charcot's neurologic triad in multiple sclerosis. Now let's talk about the risk factors associated with multiple sclerosis. There could be genetic as well as environmental factors. So there are genetic factors such as it has been shown that people who are showing defects in their HLA-DR or HLA-DQ locus, which are associated with class 2 MHC molecules, they show more susceptibility towards developing multiple sclerosis. Also, environmental factors such as viral infections can also increase the risk of multiple sclerosis or are associated with multiple sclerosis. Let us talk about few more environmental factors. Sunlight and vitamin D plays a crucial role. So overall, you can understand diet is important. And there is a overall factor that women are more susceptible than men. And this is also because of a genetic factor. It has been shown the occurrence of multiple sclerosis is much more in those regions which has low sunlight, and thereby people have low vitamin D. That means it is lesser in the equator, and the incidence rise when we go away from the equator, and this heat map gives you a quick idea. Multiple sclerosis pathology is characterized by confluent demyelinated areas. So this is how a healthy brain look like. And this is how a MS brain look like. In this case, you can first see there are cortical demyelination. But cortical demyelination takes some time and happens in the advanced stage of this disease. Initially, the scars or the lesions appears in the white matter, and these are detectable in MRI imaging. And these scars are occurring due to the defect or destruction of the myelin sheath and the oligodendrocyte which forms this myelin sheath. Let's talk about the subtypes of multiple sclerosis. So if we plot the percentage disability in the y-axis and the age or the timeline in the x-axis, then the graphs would look like this. This first type is known as relapsing remitting multiple sclerosis. I'll come to it in a bit more details. The second type is known as secondary progressive multiple sclerosis. Then there is primary progressive and progressive relapsing. All these are really important. But the most common one is the RRMS, or relapsing remitting multiple sclerosis. Here, there are bouts of autoimmune attacks, and that is kind of spaced between months or years. So there are aggravation of this disease over time. And the secondary progressive multiple sclerosis has a steady progression of disability in the later half of this particular disease. And in case of primary progressive multiple sclerosis, there is constant attack on the myelin sheath. So rapidly the myelin sheaths are degraded. So disease progression is relatively faster in this type of multiple sclerosis. And progressive relapsing is even faster. So there are like continuous attack, but in bouts the attack becomes even more severe. Now let's talk about the immunology of multiple sclerosis. So generally the T cells develop in the thymus. But in the thymus there are mechanisms known as central tolerance, which prevents the generation of autoreactive T cells. Even in outside the thymus, there are peripheral tolerance, which ensures there are no autoreactive T cells which could be harmful for the body. But for multiple sclerosis, this tolerance mechanism fails. If you want to know more about tolerance, you can click on the video in the I button. And that leads to many complications. There are too many autoreactive T cells in the circulation. They can ultimately cross the blood-brain barrier and can enter the brain. So the brain is no more immune privileged, and that is pretty dangerous. Inside the brain, there are several things that happens. So in the myelin sheath, there are antigens such as myelin basic protein, proteolipid protein, myelin oligodendrocyte glycoprotein. All of these antigens are detected by these autoreactive T cells. So autoreactive T cells actually kind of get activated and affect the myelin sheath. Now there are infiltrating antigen presenting cells which further present these antigens to these T cells. Now this aggravates the reaction. These T cell, once get activated, secrete several other subtypes such as Th1 or Th17. Both of these T cells are highly associated with inflammatory processes. They can secrete cytokines such as interleukin 1, 6, TNF alpha, etc. Now, overall, there are Th1 and Th17 subtypes are associated with multiple sclerosis, and current research shows there could be one particular dominant population, but it's kind of debatable at this moment. Anyway, there could be other factors which are affecting the disease progression, such as the regulatory T cells. Regulatory T cells generally prevent the activity of any kind of T cells by producing the cytokine interleukin 10. So it's kind of like a speed breaker. But in case of multiple sclerosis, often it was observed that the regulatory T cell function is abrogated. That leads to further increase in autoreactive T cell activity. That can be damaging for the brain. So let's talk about how can we diagnose multiple sclerosis. One of the options is to look for clinically relevant biomarkers, and that can be done by taking out the CSF by lumbar puncture and analyzing the CSF for several biomarkers like myelin basic protein, IgM oligoclonal bands, neural adhesion molecules, and many other factors. So these biomarkers can help us to predict whether there is a chance of developing multiple sclerosis or not. Then the best way is to do by magnetic resonance imaging or MRI, and this is the most useful diagnostic tool for multiple sclerosis. Classically, MRI will show lesions in the white matter in the brain, and that is pretty characteristic of multiple sclerosis. Currently, there is no treatment for multiple sclerosis, but there are supportive treatment and immunosuppressants which can help the patient to have a better lifestyle, or like it can reduce the pain. So it's kind of like a supportive medicine, but there is no absolute cure for this particular